In this video, I will demonstrate how to draw blood samples from a central line. If your patient has a central line, it's the RN's responsibility to draw all lab work. So the first thing that I have done, as always with central lines, aseptic technique, strict aseptic technique is crucial to prevent infection. So the first thing I do is I have identified my patient, I've cleaned my hands, and then the equipment that I need 2 to 3 syringes of normal saline flush. Some facilities use prepackaged saline flush syringes, and that's great. Other facilities, you fill your own syringes with normal saline, and that's what I've done. I've filled it, I've gotten rid of all air, and I've labeled it normal saline because all syringes leaving the medroom need to be labeled. So I have my 3 flushes. I need 2 to 3 empty 12 ml syringes, depending on how much blood I'll need to draw. I need my lab tubes for the tests that have been ordered. I need blood transfer devices, and I have 2 different types here that I'll demonstrate. Non-sterile gloves and goggles to protect me since I'm working with blood. And I need enough alcohol swabs so that I have a fresh one for every time I access the port. I also need patient labels to put on the tubes, and I have to be able to do that right at the bedside, so make sure that you have the patient labels before you start the procedure. If your patient has an IV running, you need to stop it or pause the pump if they have one and wait a minute. If they have blood or lipids or heparin running, then you need to wait 5 minutes. So we just have normal saline, so I will clamp it and we'll wait a minute. I need to use the distal port of a central line to draw the blood, so I've got that here. And I'm going to get myself ready. Evidence-based practice tells us that the optimal time to clean an IV hub is for 15 seconds. And research has also shown us that the most common source of infection, of bloodstream infection, is through the ports. So scrubbing the hub for 15 seconds is crucial. And I'm going to use my watch to make sure that it's 15 seconds because it does seem like a long time. And if you're just guessing or counting in your head, you probably won't be doing it long enough. So using friction, do the top of the hub and the threads of the hub. Okay, and I have unclamped my port. Now I need to flush it to check placement and to flush the line. So I have my first normal saline flush. And as always with central lines, I need to pull back and aspirate for blood, which I have here, to make sure that I am in the vessel. So I see that I have placement, and now I do a push pause. And remember, with central lines, you never use smaller than a 10 to 12 ml syringe. Okay, now I need to withdraw some blood to discard. The amount depends on your facility. Usually it's 5 to 10 mLs. So I'm going to, my facility says withdraw 10. So I've withdrawn my blood, and I'm going to lay this aside to discard it in hazardous waste when I'm finished. Now I need a clean alcohol swab. And There, as I said, there's two different types of transfer devices. This blue one is really nice. It just screws right to the hub of the port, and you can withdraw blood from that. So that's what I will do here. So I'm going back into my port and scrubbing for another 15 seconds. For the purposes of this video, I'm not going to do it for 15 seconds so that we can move along, but you absolutely need to do that when you're working with a real patient. So this type of transfer device, it's a one-time use, and the hub will screw directly onto the saline lock. There's a needle inside that you don't want to touch. And I'm going to take my first blood tube and insert it and fill it up with blood. Now on this mannequin it doesn't fill completely, but you would want to do that. And then give it a gentle rotation to mix it. Lay it to the side. Then I can take my second tube and do the same thing. Put it right in here, fill it up with blood, gently mix it, and lay it to the side. When I'm finished with that, I need to flush the line again. So I take a new alcohol swab. And the amount of flush after drawing blood is usually more than a regular saline flush, a regular routine flush. So the amount depends on your policy. It's usually 10 to 20 mLs. So I'm going to take my second syringe with normal saline. And I'm going to do a push pause and clear the blood out of the line. Now this facility requires me to use 20 mLs, so I need another alcohol swab and a new syringe. You always use a new syringe when entering the port, and I will scrub the hub again for 15 seconds, although I won't do that for this video. And now I have my third flush that I brought in with me. And then when I'm finished, I would need to make sure and clamp my line. But I'm going to show you the second type of device. Now you would not want to touch the end of it, but I want to show you how this works. So the first transfer device fit right on the port really nicely. This one doesn't. So you can see that it doesn't do that. This will attach to a syringe. So I have a new clean 12 ml syringe, 10 to 12 ml. And I would scrub my hub again, just like I did before, 15 seconds. Oops. And then my syringe goes directly on the port. I withdraw some blood. Then I want to attach it to this transfer device. And then I can put the blood into the tube this way. Now if I have enough blood in my syringe for the second tube, I can fill that, and I do. If I had more tubes of blood and needed more blood than I have in the syringe, whoops, I need to do that, and I don't have enough blood in my syringe, then I would need to get a new syringe because you'd never use the same syringe to access the port twice. So I'm going to lay that aside, and I have my 2 tubes of blood that I've mixed. Now, of course, if I had used this transfer device, the same thing would apply, that I would need to flush it with 10 to 20 mLs of saline, and when I was finished, I would need to clamp the line, although that one is not flushed, so I will flush it. Scrub the hub for 15 seconds. And flush my line. And now I want to label my tubes. I need to initial them, put the date and time, so my tubes are labeled, and if I did have an IV running, I would want to restart it, clamp the line, restart my IV, and take my blood directly to the lab. Anything that had blood in it, I need to dispose in hazardous waste, and the transfer devices go in a Sharps container. And that's it.